Good afternoon. It is so wonderful to see you today on our Israel Minds series that has begun in the month of February. All month long, we will be hearing voices from Israel, and they are in a wide range of topics. But today, we are starting with perhaps most important voice we'll hear this month, and a person who's dealing with the topic that is most on our minds, perhaps more than anything, and that is the health and well-being and how a country and how a world handles COVID. And so I'm going to share with you a little bit about our special, very special guest today, Professor Eilat Shinar. I also want to thank the staff of American Friends of Magen David Adom, who are here with us and help put this together. They're going to drop, for those of you who are on Zoom, in the chat, ways to donate to MDA if you would like. And those of us who are sharing this program on Facebook will share that as well, or you can just reach out to us because they've been amazing in helping us. Dr. Shinar is the director of Magen David Adom National Blood Services in Israel since 1997, the sole organization providing blood units and components to all civilian hospitals and to the IDF. She was born in Israel and acquired her medical education at Hebrew University and Hadassah Medical Center, where she worked as a specialist in hematology-oncology. She was a research fellow at Children's Hospital and Harvard Medical School in Boston, conducting pivotal studies on the structure and function of the red blood cell membrane in alpha and beta thalassemia. During the last 30 years, she's daily involved in all aspects of blood banking, including recruitment, acceptance, criteria for blood cord, human breast milk, development of new technologies for blood collection, novel usage of blood components, and RD, CR, and all other aspects of transfusion medicine. She's the author of over 100 scientific papers and teachers at universities in Israel. She's chairperson of the advisory committee of the Israeli Ministry of Health on blood usage in emergencies. And she is a member of the Global Advisory Panel on Corporate Governance and Risk Management of Blood Services and Red Cross and Red Crescent Society. Professor Shinar is married to Yoram and mother to Asaf and Noah and Anat and grandmother to Yotam, Lavi, and Mika. And it is an absolute pleasure to have her here with us today. And just a couple of things to keep in mind about dealing with blood in Israel. There is an active military dealing with not just wars, but issues of terrorism, a country that is surrounded by enemies. And the origin, even that there is a Magen David Adom, is tied up with histories of the Red Cross and others. So there's so much in talking about everything we will talk about with Dr. Shinar today, but we're going to let her start off. She has some words that she'll share with us, and then we're going to open it up for Q&A. And if you have questions, you can put them in the chat or communicate any other way through email or text to me as well. So Dr. Shinar, welcome. Thank you for being with us here in Boca Raton.
Thank you very much, right, Jessica, and thank you everybody for joining us. And thank you for giving me the opportunity to talk to you about the subject I like most, after my family, of course. And this is the providing blood and our plasma, we'll talk about it, to the people of Israel at all times, wars, peace, and now under the pandemic of Corona, which is a very, very challenging. I just want to say, for those who do not know Magen David Adom, maybe there are few of you among us, that, that Magen David Adom was actually established in Israel in 1950 by a law from the Knesset, giving Madad the responsibility to do all the emergency medical services, so all the ambulance services, the pre-hospital services, and the blood services. So we are really the sole provider of blood to the country. There's only one in Israel, both to all the civilian hospitals and to the IDF, because unlike the States, the IDF in Israel does not have a military blood bank, so we provide them blood at all times. This is very challenging. We are very lucky that the Israeli population is accustomed to do things for each other. And usually during peacetime, we are collecting close to 270,000 units of blood per year. We do all the component processing, we do all the testing, and we supply blood to all the hospitals and to the army. And we monitor the national blood inventory to make sure that we'll have enough in case of any surprises. And emergencies in the blood services can be what I call the private emergency. If a lady who is O negative, for example, is bleeding during childbirth and needs many, many units, this creates an emergency in the hospitals and in the blood services, or any kind of multi-casualty events that we used to have very many in Israel, any kind of a military escalation, and now a pandemic. And I think Corona taught us a lot of how we should manage the blood services, what we should do. And I would like to maybe share with you what we've done in the last almost a year now, because the Corona in Israel really started in the month of March. First, there was some cases that were actually imported from Europe, but after Purim, which was the second week or the first week of March, we got an increasing number of patients. And so far till today, we have 3 waves of infection, the rate of infection going up, the number of severe cases, and the number of deaths, unfortunately, increasing. And every wave is worse than the previous one. So if in April we thought that this was it, then we got the second wave around August or September. And then we are now in the midst of the third wave, which is the worst of all. Infection rate in Israel right now is about a few thousand people per day discovered from the testing being done. Many patients who are severely ill are hospitalized in the different hospitals, in the different corona units. Many are ventilated, and unfortunately, close to 5,000 dead, which is a real thing in Israel. We are under lockdowns. This is the third or fourth, actually, lockdown that we have in Israel. And this was the first issue. How do you recruit blood donors? How do you collect blood donors to have enough blood for the patient in the hospitals? Because during the whole time, the hospitals continue to do their regular work, not so many elective surgeries, but to treat hemato-oncological patient trauma cases, severe deliveries, any some operation that needs to be done. So we had to go on continuing supplying the blood, but we had to change the whole way we operate, because usually we collect blood in working places, in military camps, in all kind of gathering. And of course, once you have a lockdown, you cannot gather. You have to have distance, social distancing between people. We have to do a special request for the government to include among the things that people can do during lockdown, which is to go and donate blood and later on plasma. We'll talk about it in a minute. We have to, as we couldn't go to working places or to universities or to yeshivas because everything is closed, we have to really recreate the way we collect blood. And we came up with a way to go to the neighborhoods. So we would go to a neighborhood with some high rises, we'll connect with somebody or somebodies who can help us recruit the people. We would send emails, we'll announce ourselves, having our 4-bed mobiles, 2-bed mobiles down there, and just calling people to go, come down and donate blood. And it was fantastic to see the response of the public because people really wanted to do things. And when you're at home and you can't really do many things and you're very frustrated because of the situation, what better than go down and meet MDA teams and donate blood and save people? So this is still working with us. We are continuing to do that since actually March. This is how we can go on supplying all the hospitals with all their needs without having to cut on blood supply to patients who need this treatment to save their lives. We actually went on with this project till we got into the second phase of what we're doing, which is the collection of plasma from people who recovered from corona, from COVID-19. We call it COVID convalescent plasma, CCP, in order to treat the, first it was severely, but then we realized we have to do it to even the moderately sick COVID patients. The idea behind using CCP is that people who recovered from COVID-19 have antibodies in their plasma, which are the proteins that they created, their immune system created as because of the exposure to the virus. So to take this plasma for people who recovered and give it to patients who are still in the midst of the fight against the virus and don't have their own antibodies is actually called passive immunization. And the idea of doing it is not a new concept. We have used it before in the world and also in Israel in other small, I would say, epidemics like West Nile virus that we had in Israel, or smallpox when we prepared some plasma rich with antibodies in the past. So the idea was to start collecting plasma from people who recovered and give it to patients who need it. There is still a national study going on, investigational study, where we continue collecting the plasma. And based on our own experience and later on experience mostly from the States, from Mayo Clinic, about more than 30,000 patients, and from last from Argentina on some hundreds of thousands of patients, we understand that this treatment can be effective only if the plasma is given really early in the course of the disease, in the first few days, and if the plasma contains a nice amount of antibodies. So here it was again tricky to find the donors, to bring them in, to choose from them those who have high level of antibody, and then transfuse it to the patient. As I said, this is still going on. This third wave, we are collecting every day close to 50 donors, and we provide plasma to more than 40 patients nationwide, and the number is still increasing. And again, we know that it would not help everybody, but it will help patients who get it, as I said, early, and plasma with high level of antibodies. So when we talk about corona from the blood services, these are the two main streams that we are very busy with. To add to the plasma, I have to say that there is an Israeli company who can make concentrate antibodies, immunoglobulin, from the plasma. So if we have enough, we supply them with our plasma, and they can do that also for patients. However, going on with what we do in Israel, and I want to maybe take a minute and talk about how MDA, Magen David Adom, is working during Corona, because since the beginning of the pandemic, MADA was super busy. First of all, with opening a huge center call, which some days responded to over 50,000 calls a day, because the instructions were not clear. People wanted to then understand what to do. And people in Israel are used to dial 101, which is the Magen David Adom number, to ask questions. And the Ministry of Health asked Magen David Adom to open this call center, thinking there will be maybe 1,000 calls a day. And we found ourselves recruiting more and more people who would respond to the public, so there'll be an answer for the people. The second thing that we were involved very quickly was with sampling, or taking the samples for the diagnostic test for corona. And this have been, the number went up to more than 4 million swabs. MADA went to nursery homes. We call it the protective effort for fathers and mothers, Magen Avot Ve'imahot. We opened drive-through or drive and test location where people can come and just not leave their own car and be tested while they are still sitting in the car. Going to homes, going to neighborhoods where people do not have cars, then going from one place to another, from one home to another, and trying to get the Ministry of Health a good picture of what's going on. Last but not least, we are now heavily involved with vaccination. MDA, because of our logistic spread in Israel and the quickness of how we respond to challenges, have now vaccinated many of the 3 million people that have already been vaccinated in Israel. And we do think and we know that on one hand side, the vaccination rate has lowered the new cases among people who are 60 years old and over. So we see a lesser number of newly infected cases among the older people who got already vaccinated, most of them with the second vaccine already, with a second injection. In Israel, we give the Pfizer vaccination. However, because of the British mutation, on the other hand, we see more new cases, we see more patients who are ill, and as I say, more severely ill. So the British mutation not only is infecting more people, but also causing a more severe disease. Just to finish on some of the cherries in the cake, because so far we've talked on a regular bread and butter and on the pandemic bread and butter work. I think that being the central laboratory for blood in Israel, or the Central Blood Services, we're exposed to all the different blood types that we have in Israel, because we are a country that have immigration from all over the world, more than 150 countries. And as blood types are genetically determined, we have a paradise for blood bankers in our country. And we are following and trying to really detect the people with very rare blood types. Some of them who need transfusion, some of them who are women who are pregnant and need to be followed up to make sure that they finish the pregnancy and have healthy babies. So this is another little corner of what we do with the National Laboratory for Rare Blood. On the same topic, we actually have a cord blood bank, public cord blood bank, where we collect cord blood with stem cell from different people from different ethnic group in Israel, to make sure we can give these units to people who need them and are not all from Caucasian, as you call it, or Ashkenazi, as we call it, but from the minorities that we have in Israel. In the last 8 months, during the Corona crisis, we also concentrated on opening the first human breast milk blood bank, where we collect milk from women who are willing to donate it. We process it, we pasteurize it, and we make it available for premature babies in the internal intensive care units or neonatal units all over the country. So this is a very new project, the baby project, which we love. And of course, when the Ministry of Health asked us to do that, we said, of course, yes, because it is our motto, it's life-saving. We save lives by ambulance and emergency medical services. We save blood by we save life by blood, and now we save blood using human milk. I could go on and on talking about my favorite topics, as you may understand, but I think we do need to leave some time, right, Jessica, to a question and answer, and I'll be here with you. I just want to say one thing. I really want to thank you so much for helping us and supporting us. And one of the most important projects that we have right now in Israel, in the midst of everything we are going through, is the concluding of building the new Marcus Blood Services in Israel. This is a place where we would be able to process close to 500,000 units per year. So it will take Israel for another 20 years for a safe blood supply. It will be protected against earthquakes. It will be protected against conventional and non-conventional weapons. So this is really one of the most important projects, and it's all done by support from our Friends Society, mostly the American Friends of Magen Adom. So here is a major contribution to the country and to the people of Israel. And this is why I want to thank you so much for hearing me and for helping us. Thank you so much.
Hey, Jessica, we can't hear you right now. Can you check your microphone?
Is that better?
Yep.
Okay. Dr. Shinar, if you can tell us about your best day during the pandemic and your worst day during the pandemic.
I would say that I can say that maybe it is connected to the same story. Our worst day was actually almost in the first week where we started collecting plasma. We got a request from the hospital for 2 units to a young man, 40 years old, a father of 7, who was severely sick. And we just started with the project and we didn't have plasma. And there's something, this is very frustrating. You know how to do it, but we hardly opened or started the project. This was Friday. We located a woman who was compatible by blood type for that man. We brought her from Jerusalem. She actually she said she's going to drive to the blood services center, which is near Tel Aviv. She donated the units. We prepared them and immediately sent them to the hospital. And I said, okay, at least we did our part, but I was not sure that we'll be able to help these men. So this was very frustrating. I remember the whole day was very, very tense. It was Friday and then Saturday, and we didn't know what is going to happen with this man. I can tell you that and we called on Saturday, Motzei Shabbat, and they told us that he's still holding on, but the situation is very severe. 3 weeks later, I see a publication from that hospital, a press release of a young man, 40 years old, who came actually back to life. And they're showing him on a wheelchair going out of the hospital to rehabilitation center. And I said to myself, oh my God, this is the patient. This is the same patient. So this was the first and very important case. Since then, we had many like this, but it is really putting together. We are not supposed to know the patients. We are not supposed to really be connected personally with the patient whom we supply blood for. But for me, this was really a very tense moment, the worst one and the best one on the same pace.
Amazing. We have a question in the chat. What can be done about the ultra-Orthodox who continue to flout pandemic controls? Just last week, thousands attending a rabbi's funeral with police watching. Do you want and actually, in addition to that question, can you address Israeli society in the pandemic? You alluded to it in your opening, but there's a societal unity that exists in Israel, like that doesn't exist in other parts of the world. We're united by a history. We're united by enemies who want to destroy us. We're united by a national culture that includes, coming into the army and a tie that anyone who's visited Israel is able to witness. So if you can answer that question about the ultra-Orthodox, but in general, what has been the advantage of being in Israeli society during the pandemic, and what's also been difficult about Israeli society, which I think the question alludes to.
Yeah, I think we have to be careful when we're talking about the ultra-Orthodox in general, because I can tell you that when I go through the donor room, I can see so many yeshiva bochers and avrechim, really people ultra-Orthodox, who come to donate either blood or plasma. People from yeshivas do that, and also the Arab population donates blood and plasma. So when you talk about people who really want to come and help others, then I can see the very nice side of it. The other side is very, very frustrating because as today, somebody said, it's not somebody, it's Yuda Meshi Zahav, who is the head of Zaka in Israel, very famous organization who really help identifying people who were killed in terrorist attacks and other. He lost his parents and his brother, his parents to Corona, COVID-19, and his brother to a cardiac event. And he said today, I really cannot, and he's very, very ultra-Orthodox. And he said, I cannot understand what's going on in our society. I cannot understand that thousands, many thousands of people come to accompany Rabbi Soloveitchik in his last way. He was a very important man. He died from COVID-19. So while being there, we are creating more and more new cases. So I think one of the things maybe should be to find ways to the leaders, not political leaders, but to the rabbis of the different groups, Hasidic, Litaim, and others, and to really convey the danger of what we are going through. This is a danger enemy. We have been through many wars in Israel and many conflicts. I don't think we've ever fought something like this virus. So this is really something that worries a lot of us in Israel, both in the decision-making, health and others, and just the people on the street, of how do you convey that this thing is serious? People are dying from this virus, and we need to be so careful to try and improve the way we're doing it. But again, I would not generalize because on the other hand, when I go home and I see that all the beds are full with very Orthodox men who came from Brain Brak or Mea Shearim or Ashdod to donate blood and plasma, I can only thank them for saving lives.
Absolutely. Yeah. Every society, that's been one of the downsides of the pandemic, how it's either become politicized or loaded for one area of society or not. And it's ultimately about saving lives. Looking to the future, we have a question about when do you view travel to Israel and that we'll be able to be tourists in Israel again? It's hard we can barely talk about the high holidays, for this year, let alone, down the line. But when do you, from your medical perspective, when will it be safe to travel, do you view?
I would say that about a month or, a month or 2 months ago, I would say, well, few months and we are done with that because of the vaccination and because of really the more we vaccinate the people, the better vaccination we'll have in the society. I have to tell you that I'm not sure anymore. I think we need to prepare ourselves to live with this for some many months. And if we'll be nicely surprised, then great. But I think we know that viruses make mutation. It's not a new thing. The fact that we know that, for example, we have to take the flu vaccine every year because of the change in the antigens in the viruses. But because we all expected, our expectation was so high that now we'll have vaccine and we'll be free of it and we'll be able to get our lives back. I'm not sure. I will be very careful about it. I think that even with vaccination, we still have to keep on social distancing, wearing masks, keeping hygiene, behaving differently. It's very hard for Israelis. We are really love to hug and kiss every time we meet each other. No more. You have to keep a distance. You have to be very kind of suspicious to whom you are talking to. It's hard for the people to work with masks the whole day. But I can tell you that every day when I go through the blood services, we have about 300 employees, some of them phlebotomists who are taking blood out, and some of them are working in the laboratories. And I keep going there and reminding them, put your masks on, don't drink coffee with each other, keep distancing because you might get infected.
I want to dig a little more into you and who you are. Often with Israelis, there's a background of how your family is in the land of Israel, and you've been at Magen David Adom for decades of your life. And it's ironic, you're named after one of the most relaxing places in Israel, Eilat, and you're probably in one of the most stressful jobs. So tell us a little bit more about your history, you know, in the state of Israel, and also with Magen David Adom, and how you know what your days there mean to you.
I'm a second generation Sabra. My mother was born in Haifa, and I was born in Haifa. My dad came from Poland with his family when he was 13 years old in 1933. So they were really saved from the Holocaust, and they the whole family came to Israel. I grew up in Haifa, and after being in the army, I wasn't I was in the intelligence. I was not didn't have to do with medicine in the army. I graduated Hadassah Medical School in the Hebrew University and stayed there because I chose medicine because I think it's a wonderful profession. It's a combination of treating patient, talking to patient, a lot of science, a lot of teaching. So I like these very interesting fields that can be combined. And I worked with at Hadassah for many years, including my time in Boston at Harvard. And when I came back, I was recruited by the previous head of the blood services to actually operate the pheresis unit. This is the same one that we are collecting the plasma from the convalescent people today. And people looked at me like I was crazy. Everybody asked me, are you leaving Hadassah, the jewel in the crown of medicine of Israel, and going to work with Magen David Adom, which at that time was a very, very hard financial situation? And I said, yes, I'm going to do that because the job I was offered, first as the pheresis unit director and then the blood services director, is one of the most important jobs in the country. It's really to make sure that all the patients in Israel will have the best quality and in enough quantity blood that medicine of any year can do. So the joke in MDA is that most people in MDA grew up from being youth volunteers. Apart from us two medical doctors, myself, and Dr. Rafi Strugo, who is the head of the emergency medical services, they are joking that we did not volunteer in MDA because we just stayed home and studied. And this is how we got to medical school, and this is how we got to being a physician. But really, I think this was the best decision of my life. I think the combination of working with volunteers, either volunteers like people in MDA or volunteer blood donors, make you a different person. When you work with patients, myself as a medical doctor working with patients, and I'm a hematologist, so I had my time with very, very severe cases. The patient that come to you needs you. When you work with volunteers, you need your volunteers. You cannot operate without the volunteers. So I think this makes us better people because we share our life and our work with such fantastic people that are working with us. Magen David Adom, I think, is one of the most important organizations in Israel. You know that unlike the police and the army and the firefighters, we're actually not financed by the government. We have the same importance as one of the four arms of security in Israel, but we are not financed by the government. So it's also a constant struggle for every one of us in the high management to try and see how we can achieve to give the people of Israel the best medicine we can and the best treatment we can while struggling for funds. And this is something I would probably like to have it different, but that's what we have, so we cope with that.
And I don't know if it's a myth or true or not. Can you talk about why there was a need for a Magen David Adom? What was the Red Cross doing and not doing for Israel? You know, as Israelis and as Jewish people in history, we've often had to make do for ourselves because of, you know, anti-Semitism or whatever is going on in whatever lands we're living in. Can you just address that a little bit? Why the Red Cross is not in Israel? Like how that came to be?
Well, I would say that the beginning of Magen David Adom really goes back to 1916. because there were some people in Israel who wanted to take care of the Jewish prisoners during World War One. In 1930, Magen David Adom was formed in Israel as like a Red Cross society. And this happened after the riots in Jaffa. Jewish people were killed there, and there was nobody to take them to hospitals. There were few hospitals in Tel Aviv, maybe one or two. So Magen David Adom actually started as an ambulance service like the Red Cross. The question of Red Cross, Magen David Adom, and Red Crescent, to understand that, people need to understand that in each country, there can be one society. It can be either Red Cross, Red Crescent. When Iran was under the Shah, there was also the Iranian Lion, which was took off when they took over. And in Israel, it is Magen David Adom. So it took us 70 years, 70 years, to tell the Red Cross that we would like to join the Red Cross and Red Crescent Federation as a full member, but with one condition, that we continue bearing the Magen David. There's no way we can put a cross or a crescent on the ambulances. There's no way we can put it on our uniforms. So it took a lot of time. There was a huge help from the American Red Cross because they told the Federation they're going to hold the dues if they don't accept Israel. And it was time in 2006, at the time of Arik Sharon, he was the prime minister, who actually authorized Magen David Adom to become a member of the Federation, Red Cross Red Crescent Federation. And we had to do it together with the Palestinian Red Crescent. So if you are in Israel today, if you are in Israel, then it's Magen David Adom. If you go to Nablus, or if you go to Ramallah, or to other places in Israel, or in the Palestinian part, you will have the Palestinian Red Crescent. On the field, we work with full collaboration. If there is a car accident, let's say, in the West Bank, we can both arrive there. Magen David Adom will treat the patient. Red Crescent would treat usually the Arab patient. And if needed, they will be also evacuated to Israel. On a point of professional collaboration, I can tell you that even before MADA was part of the Red Cross and Red Crescent, we got a lot of support, mostly from the American Red Cross. All the programs of the new facility in Ramle, the new blood services, the new Marcus blood services, are based on some of the plans that we generously got from the American Red Cross and other Red Crosses, like the Australian. So being from a professional point of view, I think it's very important to be a member of the Federation. And last but not least, I'm a member of a global advisory panel on risk management, because of blood is a risky business. And I can tell you that when I sit in the meetings and I have a sign of Magen David Adom in Israel before me, I'm very proud. So it's not only the personal aspects, professional personal aspects, but also representing Israel as the national society, representing Magen David Adom as a national society of Israel, is what I think is important. The only thing I need to add that, for example, when there were a terrorist attack in Bulgaria or in other places, in Turkey even, Magen David Adom contacted the Turkish Red Crescent. They waited for us in the airport. They accompanied our team to the hospitals. And Israeli victims of the terrorist attack were evacuated to Israel with the help of the Turkish Red Crescent, despite the fact that we are not really the best friend of Turkey right now. So I think it's a very, very important part of being part of the federation in the world.
So that reminds me of a story that was in the news yesterday that about getting vaccine to the Palestinians and what's being accepted and what's being refused and what other countries they're waiting from. I'm wondering if you can comment on that. And then I want you to address Israel's vaccine rollout. I was on a Zoom call last week with a rabbi in Israel who's in his late 40s and he had been vaccinated. I think he'd had his second dose maybe by the time we spoke. What happened in Israel that the vaccine rollout has gone the way it has, and what was MDA's role in that? And you could talk a little bit more about the Avot V'Imahot.
Yeah, Magen Avot V'Imahot. I think that the question was, should Israel allow the Palestinian Authority to get vaccines? And actually, they are going to get the Russian vaccine, the Sputnik, which I think everybody in Israel felt that there should be no restriction on that, especially when there are so many still workers who come mostly from the West Bank to work in Israel. And we better have them vaccinated than not. On a second thought, I think again it brings us to what Magen David Adom is. And you know, our motto is Kol hamatzil nefesh kilu itzil olam umlo'o. Who will save one life is like to save the entire world. So if we can save people from being sick and also from infecting others, I think we should be there, especially when there's no shortage of vaccination in Israel. So I don't, I've read today that they are considering even to give some of the Pfizer vaccination. The Pfizer has some problem, we'll talk about it in a minute. But I think that, yes, we live in this neighborhood. These are our neighbors, okay? We cannot choose the neighborhood. And I think we should do anything we can to save lives, put politics aside and save lives, because this is what we do. And when you look at Israel, you look at Magen David Adom, you look at the teams, you would see the very Orthodox and the non-religious, the seculars and the Arabs and Jews and Christian and Muslims all working together. So for us, it's really natural to do the work with everybody. Everybody is doing the work to save everybody. The vaccination program in Israel, I think, surprised most of us. I think the idea, first of all, for Prime Minister Netanyahu to get that amount of vaccines, I think chapeau. I mean, people can criticize him here and there, but the fact that he got the agreement with Pfizer and then also with Moderna and got all these millions of vaccines at very, very quick timeline is amazing. The question was, would people come to be vaccinated? Because people were afraid, and we have these people who object to vaccination, and we have all kind of like everybody else in Israel. And there were many or some videos that the Ministry of Health prepared on trying to convince people to come and be vaccinated. And then we realized there's no need for that. Israelis just wanted to get vaccinated. So the idea is, because the Pfizer vaccination is such a complicated logistic matter, it has to be kept frozen until before use. Then if you put it in the cold, you have to use it within 6 hours. So when we took on ourselves Magen David Adom to do that, we have a truck with freezers that kept vaccines in the freezer, frozen. Once the bottles came out, then they were used. And every time that we were coming to a point that we have vaccinated, for example, the whole nursing home of 800 people, I can tell you very close to the blood bank, I got a phone call from the team there say, hey, do you want to come and be vaccinated? Because we have some leftovers, and instead of throwing them back, come and bring some of the team of the blood bank and be vaccinated here. So this is how we operate. The other thing that I think is remarkable for Israel is the HMOs. The HMOs and the very strong clinics in Israel did a marvelous job. They're doing all the vaccination in general, but they opened special rooms for vaccination. And they started first with the above 60. And then while we got, as I said, about more than 70% of the above 60 years old population vaccinated with the 2 injections. Now we are actually down to the 30 years old. And today, actually, everyone who can go to these places and see once you vaccinate the target population of that day or that week, then everybody is going to use what is there to vaccinate others. Also, the point that people were asked to come get the second injection in the same place where they got the first one, at least for the first months, works very well. Today, everything is computerized, so you can get vaccinated with a second injection somewhere else. The only thing we are waiting now is for the Ministry of Health website, to be able to provide us with the green passport or the green certificate that tells us that we got the two injection. And as I said, it's really remarkable to see how people just wanted to get vaccinated, including pregnant women. And now we're thinking about children. It's amazing. It's amazing. The response is fantastic.
And I'm going to invite, if people want to put anything in the chat, they are welcome to. So someone asked, what are your views about corona and children and pending vaccine for children?
I think it's a tricky issue because unlike the first and second waves, where we thought that small children are not getting infected, and if they do, they have a very, very light disease, the picture now is different. And the only thing that prevent, I think, to take the decision to vaccinate children or young people below the age of 16 is that Pfizer and Moderna didn't really have any kind of clinical experience with that. So I would say that this is why the decision have not been made to really vaccinate all the children. A decision was made to vaccinate all the teachers and kindergarten teachers. And there we found out that not all the teachers come to be vaccinated, which I think personally it's a big mistake. Because once you're exposed to so many children, you need to be protected, or to do at least everything in your power to be protected. But I'm sure that with few weeks we'll probably hear from the companies, because as I said, the disease as we see it have changed gear. It's behaving a little different from, I would say, 6 months ago, or of course 9 months ago.
There's so many unknowns. It's unbelievable. I want to ask about medical ethics. So one of the things that I love about Jewish medical ethics is it synthesizes Torah, Talmud, halachot, and modern technology. My favorite example is with IVF, in vitro fertilization, and whether a child is Jewish or not Jewish. It's with an IVS, with implanted embryos, comes from the Book of Esther. The answer to that, I think that's fascinating. Can you talk a little bit about how medical ethics plays into your work? Do you have a medical ethics committee, and if you have an example that you can share, if it's not, divulging private information of a medical ethics decision that had to be made?
Yeah. I can tell you that it really goes back to when I was training and working at Hadassah. And I can tell you that in Jerusalem in general, and Hadassah in particular, there are patients of all places and all races and all ethnic group, Arabs and Jews, and as I said, the secular and non-secular, because of how the city is built. We have the old city of Jerusalem, we have the new city of Jerusalem, we have people who've been here for many years. And at Hadassah, we adapted I would say I adapted a very quick decision that once a patient is in their pajamas, they are patients. I would love to know their names, I would love to know the families, but I treat their diseases, and I don't care if they come from the eastern part of Jerusalem or western part. I can tell you that when we started our cord blood bank program, we had a request for a unit of stem cell to be transplanted in one of the commando, really warriors, one of the soldiers of a special commando unit. And we found a match in our cord blood bank from a Palestinian baby, because in the beginning of the project, we were collaborating with the Palestinian Red Crescent Maternity Hospital, where we collected units which were meant mostly for the Palestinian babies who were sick with oncological diseases. And then we could save a life of an Israeli soldier by a unit donated by a little Palestinian baby. And of course, it goes the other way as well. So we can have units or blood units from Israelis, Jewish, to save a life of others. A question like this was a debate in Magen David Adom when we have the terrible times of the Intifada with the all the multi-casualty events, that when you arrive to the scene, our ambulance arrived to the scene, there would be few or many injured that you have to treat. And the decision is to treat those who are the most severely injured and salvable, of course. Some of the cases, it will be the terrorist himself, because if he blew up himself, he would be the most severely wounded. But again, once we arrive at the medical body to save lives, this is what we do. We find out who is the most severely sick patient and we'll treat them. And I think that if it will happen in other places, I would like that Israelis or Jewish people will be treated according to that and not according to the fact if they are Jewish or non-Jewish, black or white, or any kind of other segregation. So I think for me, we stick to the fact that medicine is really saving life. And we always repeat our motto, we always repeat it to all our workers and to ourselves. כל המציל נפש כאילו הציל עולם ומלואו.
Let me ask where terrorism sits in your head in decision making, like the Marcus Center that you alluded to earlier, and which MD is doing a lot of fundraising for. Is terrorism is one of the factors that is, my understanding, incorporated into the design of the building. When there are terrorist acts, obviously blood is an issue. Where, like, is terrorism top of mind in MDA's daily thoughts, or is it more targeted, like, or a preventative thing? Like, it's just something every country has to deal with, but with Israel, it's I think more frequent at times and more apparent.
Absolutely. I think we do have our regulation and our standard procedures of how to do and what to do and how to respond to terrorist attack or to any military escalation from small operation to like a general war. We have that and we are prepared to do that. However, terrorist attack, which sometimes are unexpected, have to be in our mind the whole time. And even I can tell you, looking at the funeral yesterday, I thought to myself, my God, one terrorist in the middle of this funeral, forget Corona, it could be a major disaster. So looking at that, we are always looking at the fact that we have to be prepared. And not only that, we have to be prepared again, because in the neighborhood we live, if we need help, there's nobody around us who is going to help us. So we have to make sure that we'll be able to help ourselves in any case like this. Of course, if the political situation will change and will be like in Switzerland, and we can cross the borders and be in a paradise, it would be lovely. Unfortunately, I don't see it happening in the coming years, and this is when we decided to build the new Marcus Blood Services Center. Many millions of dollars were invested in fortifying the building. The fact that the laboratories are actually in a shelter that will enable the people to work there at daylight throughout the year. But if needed, we can close it and turn it to an anti-conventional, anti-biological, and anti-chemical shelter in a matter of a few minutes. So yes, this was the thought that not only we need a bigger center, not only we need a nicer center, but we need a much more safe and protective center in the Marcus because of what we're talking about.
One of the things that has been amazing about Corona is how people have come together, how teams have come together and collaborated. And I'm going to ask Ross to put a slide up about an event we have coming up tomorrow. And I want to say, first of all, in addition to a humongous thank you, because I know your life is busy and crazy, your team here, Heidi and Tammy and Chris, who's the one who made the original connection, are so amazing. And they're telling the story of your work here. You are just a hero in Israel, and the future, whatever it will look like, is bright because you are sitting in the right seat of the bus for the state of Israel and for the world at large. And I can't thank you enough. We at Bethel have been blessed similarly with congregants who from week one of Corona have taken time out of their incredibly busy lives. These are high profile doctors, nurses, medical professionals, vaccine manufacturers who have served on our COVID task force. And they're making decisions for the state and for the country, and they're giving their time to Bethel. And so tomorrow night we actually have, there's a question about vaccine risks and things like that. I'm going to let those questions be asked on our panel tomorrow night. The COVID-19 vaccine, what can we tell you, which is Wednesday, February 3rd at 7:30. And that will be on all these platforms today. And in addition, Facebook Live as well. It is the generosity of time and spirit that people have had in helping each other and making the world better. And Dr. Shinar, like, you do it clearly with a passion and a joy and a zest and a love and an intelligence that the state of Israel is in amazing hands because of you, and anything we can do to support those hands, we'd be happy to. And we've made a donation in appreciation of your speaking us to today from Temple Bethel. So I want to thank your staff, and I want to thank you and everyone who joined us here on all the platforms. We are here in the Zoom room with us, and live stream and YouTube as well. This is a month where we're coming from Israel. Craig Schwalm asked about Israel and a program for his daughter, but I'm dying to get to Israel too. We all are, but until we can be, we're going to bring Israel here next month. A dear friend, Avner Avraham, former Mossad agent who declassified the Eichmann trials material. He's spoken a bunch at Bethel. He's going to speak about espionage in the time of COVID and launching his own business, spylegends.com. The week after, we're going to have Miami and Israel. Gadi Ben-Dov, a tour guide in Israel. Israeli tour guides have not been well employed during this time, so we're doing our best to help with that. And Serge Toussaint, who's a graffiti artist in Miami, who I have a relationship with and has taught our kids. We've talked a lot about Holocaust in Haiti and the meaning of exodus and refugee. And he appeared at Bethel years ago, and so he'll be on the 16th. And then the last week, I don't know, I don't even know if Israelis know this or not, but the Academy of Hebrew Language, they're the place that makes up, if there's a new word tissue or internet or whatever, they make up that word. So it's a Hebrew word and we don't just use the English word. So Professor Stephen Fastberg will be with us talking about the creation of Hebrew words, how these words come to be, and Purim. So we just have a great month coming up from Israel. Dr. Shinar, again, I cannot thank you enough. I know it's nighttime there, so hopefully you can have dinner and relax with your family, and thank all the MDA staff that's with us, and thank everyone for joining us. Thank you so much.
Thank you so much for everybody, and I hope we'll be able to meet soon and hug and kiss as we are used to. Thank you very much. Keep well and healthy.
All right. Thank you.